Every child deserves to be raised in a healthy, safe, and nurturing environment. Unfortunately, there are too many kids brought into this world that get the exact opposite. It's why every April, a number of community agencies join forces to bring attention to this incredibly concerning issue that is child abuse and neglect. So today, we catch up with folks from Franklin County Children's Services in this sponsored segment. With me today, we have Laura LaRoche, an intake director with FCCS. We also have Angela Saucer with the Public Children's Services Association of Ohio. Ladies, welcome to Daytime.
Thank you. Yeah.
I want to quickly note today is Wear Blue Day. All three of us obviously sporting the color, and it's really aimed at bringing more attention to the issue of child abuse and neglect. So Laura, I want you to start by talking to everyone watching today, really. What do you want them to know about this issue?
The message I really want to convey is that children are locally grown. They're a product of our community. And it really does take community investment to assure that all children are safe.
Angela, remind us what the PCSAO does.
Sure. The Public Children's Services Association of Ohio represents Ohio's 88 county children's services agencies, such as Franklin County Children's Services, and we focus on sound public policy, building public value, and improving programs that lead to safe children, stable families, and supportive communities. And we're proud to host today's social media campaign, #OhioWearsBlue, to raise awareness about child abuse and neglect prevention. Everyone is encouraged to wear blue today to show their support. And we're proud to do this in partnership with our county agencies and the Ohio Children's Trust Fund.
Angela, one of the big takeaways from Wear Blue Day really is that child abuse is preventable. So what are some takeaways that you want our viewers to know about in regards to that?
You know, our message today and throughout April, as you just said, is child abuse is preventable, and that all children deserve to grow up in families that are safe and healthy. But we know parenting is hard. Parents get frustrated, they get angry at times. And as Laura was saying, there are community resources that are available for parents who are struggling, and they should not be afraid to reach out and ask for help. Anyone can use a crisis text line at any time by texting for HOPE, HOPE, to 741-741, or for more general resources such as being connected to community agencies, parents should just call 211 and reach out for assistance.
So Laura, let's end with this. You mentioned it's a community issue. So in what ways can the community help support these children who may be victims of abuse or neglect?
Yeah, I think there are 5 key factors that are easy to remember. They all start with R. One is to raise awareness, to understand that child abuse happens across all segments and ages of children. And so engaging and understanding that maltreatment is a community concern. Reaching out to youth and parents, become familiar with who your neighbors are, develop relationships with them in an effort to be able to connect and support. Remember the risk factors. Maltreatment, again, occurs across all segments of society, but there are risk factors that can impact the likelihood of maltreatment. Substance abuse, stress that families experience, isolation, particularly during COVID, that's been a tremendous risk factor. And then caregivers' experiences themselves, growing up. Recognize the warning signs. And so when you see children that may be acting aggressively, have problems concentrating, perhaps have hygiene issues, self-esteem issues, those are all risk factors that might need to be explored further. And then reporting. If you have a concern of suspected maltreatment, report it so that a family can get the help and support that they need.
And it's good to know there are just so many resources, so many ways to help just by reaching out anytime. So ladies, thank you so much for being with me today.
Thank you.